Hello, I'm Dr. Ramsey Amin. Overdentures are the topic today, and specifically overdentures that lift. Overdentures, remember, are implant-supported dentures. That means implants go underneath your dentures, and your dentures snap into place. One thing that people are confused about a lot is that an overdenture still is a denture, and it still is going to lift, and it's going to get some food underneath it. Don't get me wrong, overdentures are fantastic, but they're really intended for people that have dentures already and are looking for, strong support so that the dentures don't come out during an embarrassing situation or when you're sneezing or talking or laughing. It really helps to hold them in and preserve your bone. Two things that really reduce the chance of lifting with an overdenture are having more implants. Typically, anywhere between 4 and 6 implants, it depends on which jaw, supports an overdenture very well. It's like right now I'm sitting in a stool that has 4 legs. It's extremely stable. I can sit in a very stable chair with 3 legs, and in fact I can actually sit in a chair with 2 legs, but I still have to balance in order to stay seated. I could rock back and stay on 2 legs without a problem. So a 2 implant overdenture works well, but it's going to lift more than 3 or 4 implants. And the other reason that comes about is, well, how much bone are you missing? This model shows, a normal jaw, a jaw that's lost some bone, some more bone, and quite a lot of bone. The more bone you're missing, the more your overdenture or regular denture is going to lift. So having additional implants is always going to help keep the denture in place from moving. The other thing to consider is the shape of your jaw. Jaw shape varies tremendously. If your jaw is shaped like a U or like a V shape, that actually is going to help your implant surgeon place implants in such a way that your denture is more stable. Yes, it really depends on the surgery where the implants are put in. If your jaw shape is more like a squared off U as opposed to a V or a rounded U shape, you're going to have more lifting because your implants are more in a row rather than spread out very far. So the further you can spread them out, we call that AP spread when it comes to overdentures, the better. Oftentimes I'm limited in placing implants only towards the front of the mouth in both the upper and lower jaw because of nerves and sinuses and trying to avoid bone grafting and keep the costs lower for overdentures. But remember, an overdenture is not an overdenture is not an overdenture. Mini implants are often just a temporary solution. Please contact me if you'd like to have more information about overdentures, and there's plenty of videos and other information here on my site. Feel free to contact me. I look forward to meeting you in person. Take care. Bye-bye.